Hi and welcome. I'm Dr. Charlotte Middleton. I'm the in-house GP for Healthshare, and this month we're talking about pregnancy and birth. For our third video, I thought I would concentrate on what happens immediately after birth in terms of what as a parent you are asked to give consent for. In particular, the vitamin K injection, the Hepatitis B vaccination, and the newborn screening test that they do when the baby is about 4 days old. So what are each of these and why do we ask for your consent to administer them? The first one is the vitamin K injection. Now basically babies are born with not enough vitamin K on board. As adults, we get vitamin K through eating food that's such as green leafy vegetables that has a lot of vitamin K in it, and also we make vitamin K by bacterial synthesis in the gut. Why is vitamin K important? Well, vitamin K is a fat-soluble molecule that's involved in helping with making clotting factors throughout the body. And if you don't have enough vitamin K on board, you can't make enough of these clotting factors, and therefore you can have an increased risk of bleeding. So the reason that we give it to these babies is because they can have an increased risk of bleeding if we don't administer them with extra dose of vitamin K. This bleeding can be just simple things like bruising or bleeding from the umbilical. However, the most severe form of it can be a bleed into the brain, and obviously that can have dire consequences and even cause death. So that is why we recommend having it. You also can administer it as an oral dosing, which is given at birth and then around about 4 weeks later by your GP. So that's the first one that you're going to get consented for. And we've been using vitamin K, I think, since about 1980 in Australia, so it's been around for a long time. The second one that you're going to get asked to consent for is the Hepatitis B vaccine. Now, why are we trying to vaccinate from such an early age? Well, the fact is that hepatitis B is out there and it is a vaccine preventable disease. Why is it a concern? Well, in the short term and the long term, it can have profound effects. Basically, 9 out of 10 children that are infected as babies will remain hepatitis B carriers for a very long time. Now, why that's important is that 1 of 4 of those that have hepatitis B can go on to develop very severe things such as liver cirrhosis, liver cancer, liver failure, and even death. So it's something that we take seriously. Why we administer the vaccine to babies is that because often mothers might not know that they're carriers for whatever reason, but there also might be household contacts in the family that don't know that they've got hepatitis B. And it can be transmitted through bodily fluids, so such things as blood, semen and vaginal secretions, saliva, and breast milk as well. And so it's very important that we protect these babies from a very early age from contracting hepatitis B to protect them for a later stage. So that is the second one that you will be consented on. Just to let you know, that will be at birth, and then there'll be another vaccine at 2 months, 4 months and 6 months of age as well. The third thing that you're going to be asked to give a consent for is the newborn Bloodspot Screening Test. Now, it screens for very serious disorders in babies such as phenylketonuria, primary congenital hypothyroidism, cystic fibrosis, galactosemia, and some rare metabolic disorders. Now, of the 92,000 babies that are born each year in New South Wales and the ACT, around about 90 babies are diagnosed with one of these illnesses. And it's really important that they are picked up very early so that we can instigate immediate treatment and prevention of any further complications. And we've done that very well since we've been using it. So it's one of those very, very important tests that you'll be asked to consent for. The test is provided free of charge. As I said, it's around about day 4 that it's done, where the baby, a few drops of blood are taken from the baby's hill and collected onto a special absorbent paper. And then that's sent to a special lab at Westmead Children's, where it gets analysed and you get results back really very quickly. So they're the 3 tests that you're going to be asked to consent for and administered shortly after the birth of your baby.